Neurosis. Neurosis is a class of functional mental disorders involving chronic distress, but neither delusions nor hallucinations. The term is no longer used by the professional psychiatric community in the United States, having been eliminated from the Diagnostic and Statistical Manual of Mental Disorders (DSM) in 1980 with the publication of DSM-3. Neurosis should not be mistaken for psychosis, which refers to a loss of touch with reality. Nor should it be mistaken for neuroticism, a fundamental personality trait proposed in the Big Five personality traits theory. Etymology. The term is derived from the Greek word neuron. The term neurosis was coined by Scottish Dr. William Cullen in 1769 to refer to disorders of sense and motion caused by a general affection of the nervous system. Cullen used the term to describe various nervous disorders and symptoms that could not be explained physiologically. Physical features, however, were almost inevitably present, and physical diagnostic tests, such as exaggerated knee jerks, loss of the gag reflex and dermatographia, were used into the 20th century. The meaning of the term was redefined by Carl Jung and Sigmund Freud over the early and middle 20th century, and has continued to be used in psychology and philosophy. The Diagnostic and Statistical Manual of Mental Disorders (DSM) eliminated the neurosis category in 1980, because of a decision by its editors to provide descriptions of behavior rather than descriptions of hidden psychological mechanisms. This change has been controversial. Likewise, according to the American Heritage Medical Dictionary, neurosis is no longer used in psychiatric diagnosis. Symptoms and causes. Neurosis may be defined simply as a poor ability to adapt to one's environment, an inability to change one's life patterns, and the inability to develop a richer, more complex, more satisfying personality. There are many different neuroses, including obsessive-compulsive disorder, obsessive-compulsive personality disorder, impulse control disorder, anxiety disorder, histrionic personality disorder, dissociative disorder. A great variety of phobias. According to C. George Bowery, Professor Emeritus at Shippensburg University, the symptoms of neurosis may involve anxiety, sadness or depression, anger, irritability, mental confusion, low sense of self-worth, etc., behavioral symptoms such as phobic avoidance, vigilance, impulsive and compulsive acts, lethargy, etc., cognitive problems such as unpleasant or disturbing thoughts, repetition of thoughts and obsession, habitual fantasizing, negativity and cynicism, etc. Interpersonally, neurosis involves dependency, aggressiveness, perfectionism, schizoid isolation, socio-culturally inappropriate behaviors, etc. An acorn that grows and becomes a tree, the acorn has had the potential for a tree inside it all along. Jungian theory. Carl Jung found his approach particularly effective for patients who are well adjusted by social standards but are troubled by existential questions. Jung claims to have frequently seen people become neurotic when they content themselves with inadequate or wrong answers to the questions of life. Accordingly, the majority of his patients consisted not of believers but of those who had lost their faith. A contemporary person, according to Jung. Psychoanalytic theory. According to psychoanalytic theory, neuroses may be rooted in ego defense mechanisms, though the two concepts are not synonymous. Defense mechanisms are a normal way of developing and maintaining a consistent sense of self, i.e., an ego. However, only those thoughts and behaviors that produce difficulties in one's life should be called neuroses.